Welcome to Gay Fairfax, a weekly entertainment magazine sharing news, views, and pride. I'm Michelle Michaels.
And I'm Dave Hughes. Each week, we'll feature events and personalities of interest to the lesbian and gay community of Northern Virginia.
On this edition, we'll take a look at a local information network providing information to the medical community about HIV, the virus believed to cause AIDS. We'll also learn everything we want to know about gay cruising, the boat kind of cruising, that is.
And we'll watch a performance by the D.C. area Feminist Chorus from the 1990 Gay Pride Day celebration. But first, here's Peg McCraw with this week's gay trivia question.
What park has been named the first national gay park by the U.S. National Park Service? That's an easy one. The answer at the end of the show.
Thank you, Peg. With so much conflicting information about HIV, the AIDS virus, even the healthcare providers themselves can be confused. That's why the INOVA Health System HIV Center was created, to provide accurate information to the doctors, nurses, and dentists who treat people with AIDS. Steve Rowett explains the center's role in healing AIDS ignorance among the healthcare professionals.
Steve Rowett, thank you very much for joining us on Gay Fairfax. First off, can you tell me what your title is and where you work?
Well, I'm the nurse case manager in the Office of HIV Services for INOVA Health Systems.
That's INOVA Health Systems?
Right.
Okay. And you're with what department at INOVA?
The Office of HIV Services, which is located at 3299 Woodburn Road, Suite 220 in Annandale.
Terrific. And what do you do there?
Well, they've just started, the Office of HIV Services has just started a case management program for people with HIV infection and AIDS. Anybody who lives in Northern Virginia, is a Northern Virginia resident, is 16 or older, anyone who's HIV positive and symptomatic or HIV positive with a T-cell count of 500 or less is eligible for the program.
Okay. And describe what the program is all about, if you could. What you provide to people who are involved with the program.
Well, case management is a way of managing any type of chronic or long-term illness, trying to help patients or clients identify resources in the area they live and help them access those resources. In the case of HIV infection and AIDS, it's been demonstrated both in San Francisco and in New York that this is the most cost-effective way to manage people with HIV infection and AIDS, and it's also very good for the patient because we try to keep them in their home environment as much as possible. So there's a two-pronged approach to decrease the number of acute care hospital admissions and to decrease the length of those admissions by identifying ways to get the client back to his home environment, which is safer for him and obviously cheaper than keeping somebody in a hospital bed.
When you say access different resources, what would you mean? What types of things would you coordinate for an individual with HIV?
Well, we work very closely with the patient and their physician to identify exactly where they are in the spectrum of HIV infection and illness. They may not have full-blown AIDS at this point, and help them identify exactly what it is they need. Do they need home health care? Do they need a companion at home? Are they having problems keeping their doctor's appointment? Have they recently lost their job and they're not sure how to access Social Security entitlements or general welfare in whatever county they may be working in or living in? And we try and help them access all of those services. While we don't directly provide any particular service, we work with them. I do a complete, as a registered nurse, do a complete physical assessment on intake into the program. We have a social worker who's available for psychosocial issues and to help with short-term counseling, 2 to 4 weeks usually. And then if more counseling is needed, we'll refer them out to a mental health professional out in the area. And although we don't provide those direct services, the idea is to help them to see where they are physically at this point, to monitor their physical condition, work with their physician, and then hopefully pick up on things before they become a crisis so that we can intervene early and keep them from having to be admitted to a hospital. And just in the 4 short weeks that we've been in existence, I've already seen that happen where we've averted several crises and kept people out of the hospital simply by intervening early on. When you pick up signs of an early infection, for example, call the physician, describe what's going on, and either they go see the doc or get a prescription for an antibiotic, where sometimes people would wait at home thinking it would go away. Sometimes it's easier easier to ignore a symptom, thinking, well, it'll get better. I don't want to deal with this right now.
When you say INOVA, what exactly is INOVA? Is it
INOVA is the parent corporation of Fairfax Hospital System and several other corporations that all belong to INOVA as a parent organizing corporation.
So there's several hospitals involved? And
Right.
health
Fairfax
centers?
Hospital System consists of Fairfax Hospital, Fair Oaks Hospital, Mount Vernon, and Jefferson Hospitals, as well as the Office of HIV Services, all fall under Fairfax Hospital System.
And so INOVA first started your HIV services department for itself, or how did that evolve?
Well, one of the recommendations that the task force that met came up with was that there should be a central office to provide education to INOVA employees across the corporations in all the various facilities, because we have extended care facilities like Cameron Glen and Commonwealth nursing homes, where you're going to be dealing with people with HIV infection and AIDS. So we started out trying to provide education to our employees. About a year and a half ago, the state of Virginia, after some lobbying, decided to develop regional resource and consultation centers across the state. And the Office of HIV Service now operates the Northern Virginia HIV Regional Resource and Consultation Center, which has many different functions, only one of which is case management. We do an employer consultation service to help employers in the area develop policies related to HIV infection and AIDS, to control their costs, and many other things for employee sites. We have a community speakers bureau for which there is no fee. So any organizations like Rotarians or Lions or any other church group that would like somebody to come and talk about HIV-related issues or AIDS or wants more information, we'd be glad to go to them, and we have volunteers who will come out in the community and speak about whatever particular issue you wanted to talk about.
With your case management program, approximately how many people or how many cases do you currently manage?
Well, we're currently managing about 11. That's going to be expanded to 40. But we have set a cap that we will limit at this point our management of 40 cases. Most of the research that's been done about case management has demonstrated that beyond 40 cases, one case manager really starts to lose quality in their ability to assess the clients, work with them, and really provide the quality service they need.
Is your maximum of 40 cases enough to handle all the people living with AIDS in Northern Virginia or in the Fairfax area?
Well, we certainly won't be we aren't the only people providing case management services, and I think, as a personal opinion, that the need is there now and is going to grow before it gets better. There are 152,000 cases in the United States. In Northern Virginia alone, as of October 1st, 1990, there were over 762 cases of AIDS in Northern Virginia alone. In the Fairfax area alone, there are 269. Now, at any given point, when you're looking at the epidemic, half of those people are already dead. So if you about half those numbers, take about 60% of those numbers, those folks have died. But that still leaves several hundred people in Northern Virginia and close to 100 people alone in the Fairfax area who have HIV infection, or they're the ones that have the diagnosis of AIDS. We're not even talking about the great number of people beyond that who currently have HIV infection but may not be symptomatic or don't have the classic definition of AIDS by CDC definition. So that there are quite a few more people than just those 100 people with AIDS in Fairfax alone.
What would it take to get enough case management projects like this going so that every person living with AIDS in the Fairfax County area would have a caseworker? Is that even possible?
I don't think, in the current status of the economy and the politics of the disease, I don't think we can afford that, at this point. But I think if we demonstrate that this is the way to go, that people will begin to see that we can't not afford to do it.
So it'll cost more in the long term for health care if there's no case management up front now. Is that what you're saying?
Exactly. If we continue the cycle, as we've seen in some large cities, of patients going into crisis, being admitted to acute care facility, and then lingering there for long periods of time because they have nowhere to go and no access to health care outside of the hospital, or they've been turned out of their home, they have no significant other. Those inpatient hospital costs are tremendous, and I can't give you the exact figures, but it's in the thousands of dollars. And it's been demonstrated time and time again, especially in San Francisco, which has probably the best model of outpatient case management services for people with AIDS, that the savings is in the thousands of dollars per patient over the lifespan of that patient. So,
Well, it sounds like you have your work cut out for you, Steve. You and the people you work with at INOVA Health Systems. And I want to thank you very much for stopping by the studios of Gay Fairfax.
thank you for having me.
Ever dream of sailing away from it all with a fun-loving group of gay men and women? Well, don't be too quick to dispel that dream. You can book passage on an RSVP cruise where winter-weary gays are finding paradise afloat.
Been thinking about a dream vacation? Perhaps a cruise? Where you don't have to worry about questions about who you're traveling with or odd looks when you and your lover request a double bed? Then you're one of the reasons gay travel is on the rise. As resort operators, hotelers, and travel services are finding out, gays are their best customers. Gay-friendly travel services are joining gay-owned agencies and attracting this often affluent and discerning crowd. And more destinations are opening up to gays, according to Alan Peterson of Executive Passport Travel in Washington, D.C.
There are gay destinations, and they sort of seem to have shaped themselves over the years. On the East Coast, a popular one is Provincetown, Massachusetts. Of course, that's a big summer thing. It's beautiful, has a large gay community. Then in the meantime, we have, in winter or year-round, we have Key West and San Juan are very nice to gays, meaning there's a gay infrastructure, guest houses, bars, restaurants, where you feel comfortable, and people will tell you, help you travel. And accessible by plane, train, automobile, depending upon the situation.
At gay destinations, guests can sightsee, dine at fine restaurants, and enjoy cultural and social activities without the hassle of hiding their orientation. Olivia Cruises for Women and RSVP Cruises have made getting to gay destinations and all the places in between half the fun. Thousands of gays sail with the services annually, according to Peterson.
Ships go up to average about 700 passengers per cruise, so that's between 4,000 and 5,000 nationwide take this set of cruises. The Washington area, I'd say we have a good 5 to 8% of that people from Washington on those cruises. The demography of the clients would be average age would be in the 30s, income range about $35,000 a year. We do have a spread on the ages up to 60s, but like I said, just demographically, you'd have to say the middle range, 30s. Right now, when the cruise started, it was just girlfriends coming along as far as the women went. That was about 4 or 5% of the cruise. They've actively gone after the thing, and women are probably going towards 10% right now on the cruise.
Current gay cruise port stops include the Caribbean islands, the Mexican Riviera, and French Canada. As the cruises and destinations expand, so do the amenities offered aboard the ship.
Well, the most important thing is entertainment value and opportunities for gay entertainment. Well, a cruise is always a great experience. It includes entertainment, food, lots of things, a lot of personalized service. But gays in a mixed group sometimes will feel uncomfortable or sometimes have to go in the closet or adjust their behavior. This particular cruise, everybody's gay, and you just don't have to, there's no pretense. You just have to have a good time. You can be out front with yourself. And most of the ships, we've used the ships before, so the crew's used to us too. Of course, you hear stories about the crew, but you just can be natural, have a good time, act silly, be quiet, or it's just a relaxed experience. There's no pressure, outside pressure. And some of the ports even look forward to getting people there. Key West throws a carnival when the ship comes in. It's been a real fabulous experience.
And indeed, a fabulous experience for many it is. You might even say, a shipload of fun.
Each week when you tune into Gay Fairfax, you see only a small portion of the crew that really makes this show happen. camera operators, floor directors, lighting technicians, directors, technical directors. These are the people who really produce Gay Fairfax. If you'd like to join our crew, please write to us in care of the Fairfax Lesbian and Gay Citizens Association, Post Office Box 2232, Springfield, Virginia 22152. Or call us at area code 703-451-9528.
Feminism unites women more than just politically. At least in one case, the D.C. Feminist Chorus of Washington shares its spirit at the 1990 D.C. Gay Pride Day celebration and helps to unite women in its songs.
It gives me great pleasure now to welcome to the Pride stage, under the direction of Cynthia Thurston, the world-famous D.C. area Feminist Chorus.
I shall die, but that is all I shall do for death. I will not tell him where the black
Well, how did you do with this week's gay trivia question? Here's Peg McCraw with the answer.
What park did you pick? This answer may surprise you. Peace Street Beach, site of our own Gay Pride celebration, is officially the first national gay park. Pride is alive.
Well, that wraps up this edition of Gay Fairfax. Remember, you can tune in to Gay Fairfax every week at this time. Next week, we'll meet the founder of the modern gay movement, the irascible Harry Hay.
Plus, we'll get to see the fabulous Flirtations, both in concert and in person.
We'll close today's show with a reprise of the DC Feminist Chorus. For Gay Fairfax, I'm Michelle Michaels.
And I'm Dave Hughes. Thank you for joining us, and remember to keep the pride alive.